Welcome all. Thank you to Catalyst for inviting me to moderate this panel of amazing speakers and for constantly upping the standard on its anti-poverty summit each year. It's great to be a part of this panel in particular, given how much the subject of policing and community safety has been in the news. Too often we see the demands coming from organizers in mass demonstrations for abolition and divestment flattened into a simplistic debate about police or no police, when actually these movements are trying to push us to think about safety more holistically. What does safety mean, and what are the resources that communities really need to keep safe? I'm excited to get into it with this panel tonight, and we're looking forward to your questions. I'll just introduce myself first, and then I will introduce our panelists. So my name is Meena Jagannath. I'm a lawyer. I'm currently Director of Global Programs at Movement Law Lab, an organization that's committed to training and building legal capacity for to protect, defend, and bolster social movements. And I'm also a co-founder of the Community Justice Project, which is a local legal organization that is providing legal support to movement groups leading campaigns for racial justice and human rights here in Miami. I know that both of our speakers have many accomplishments and long bios that I can share with you, but for the sake of time, I will be brief. So first we'll hear from Rodney W. Jacobs, Jr. He is the Assistant Director for the City of Miami Civilian Investigative Panel. The Civilian Investigative Panel is a civilian oversight committee tasked with investigating abusive police practices within the city of Miami. Mr. Jacobs is also a military intelligence first lieutenant in the United States Army Reserve. He received his Bachelor's of Arts degree in political science from Hiram College, a master's degree in public health and public administration from the University of Miami, and a doctorate of jurisprudence from the University of Dayton. And our other panelist is Tim Black. Tim is the Director of Consulting at Whitebird Clinic. With a background in runaway and homeless youth, harm reduction, and street outreach, he began working for Cahoots as a crisis intervention worker in 2010 before moving into an administrative role as a Cahoots operations coordinator. His work with Whitebird and Cahoots has put him in touch with cities across North America looking to implement services based on the Cahoots model of behavioral health first response. Programs based on the Cahoots model have been implemented already in Olympia, Washington, Denver, Colorado, Rochester, New York, and San Francisco, California. Welcome to the panelists. The way this is going to work is we're going to be hearing from each one. We'll be hearing from Rodney first, and then we'll leave about 15 minutes at the end to answer any questions that you may have. So, Rodney, I'll kick it over to you. We can start off with just a background. Please tell us about your role in the City of Miami Civilian Investigative Panel, the work that you're doing either within that role or even outside of it to reimagine community safety, and also a little bit of what you see as the greatest challenge to achieving the systemic change that so many have been asking for.
Absolutely. Well, thanks for having me, Catalyst, Meena, and Tim. It's obviously great to serve on a panel with just some dynamic leaders. Meena has always been someone I looked up to in the community, so to be on here with you is obviously my pleasure, to be quite honest. But obviously looking into my role and looking into this space, I just think it's one of collaboration. Right now, at least with our office and the CIP, just a little blurb on us. Obviously, we take in complaints from the community that involve police and officer misconduct. We sign those complaints to an independent investigator, and they look into what occurred. And from there, we create a finding of fact and proffer recommendations to the police chief for discipline or retraining or whatever it may be. So our office works in that mechanism as a different option if someone feels as though a police officer has done something wrong to them. It's really kind of bolstering this notion of procedural justice and allowing people's voices to be heard. Our office gets anywhere from 200 to 250 complaints a year. We also revise and audit departmental orders from the City of Miami Police Department as well. So our office really tries to be proactive in the work that we do for misconduct. We say that when officers are involved in something that shows up on TV or something that we believe is nefarious, we haven't done our job well enough to be proactive. So therefore, we have to do a retroactive remedy, which is the investigation. So that's kind of our role in a nutshell today, at least over the next course of the next 2 weeks. We're rolling out our community police mediation program. We've selected 10 mediators from around the city that will help mediate lower level complaints. So for us, what that looks like in reimagining community safety to an extent is certain offenses that can't go through our normal traditional investigation process will go through a mediation. It's strictly confidential. What happens is you have 2 mediators that have been trained in diminishing, or diminishing and facilitating a conversation between a police officer and a community member over the instance that happened. And instead of it being a very adversarial conversation, it's one that's more humanizing, that allows officers to be seen as humans and allows community members to tell police officers how they felt with an infraction, whether it be a police ticket or something as simple as a speeding ticket. Oftentimes people come into our office and they say, hey, I deserved a ticket, but that officer was really rude to me. And I just want to know what they were thinking. I just want to be able to talk to them without the fear of, being harmed or, thrown on the roof of my car. So community police mediation allows that conversation to happen in a safe space. So that's something our office is really excited about doing and rolling out here this year. And obviously the time that we're in now, the time is now for something like that to take place. So in my space, I really look at bolstering community trust with the police. I look at what we do in our office, not necessarily as the solution to community and police issues, but more so a tool to get us to a solution that looks more like safety in our communities. Oftentimes we're asked, or we've probably sat on a lot of panels, Tim, you included, and it's always labeled reimagining community safety, or what does public safety look like, or maybe it should be something that we have here in Europe, or things of that nature. And I often say that, hey, we kind of know a lot of these solutions when it comes to implementing best practices of what the police department probably should be reformed as, or what criminal justice should be reformed as. I often say that, good policing looks like things we see in white suburban neighborhoods. Good policing looks like de-escalation. Good policing looks like less usage of force. Good policing looks like accountability measures from our elected district attorneys and such. So a lot of these things, we know what right looks like. It's just a matter of implementing them and really acting courageously in that space. But also equally important, we have to ask ourselves the fundamental question of what does safety look like to us? I was speaking to a group of people not too long ago, and without any prompts or any information, the first question I asked them is, what makes you feel safe in your community? And I went around the room and I asked people, and I guarantee, and no one in that room said police officers. They said things like the smell of pancakes on a nice summer morning, or whatever it is. It was things that they felt intimately close to, whether it be their family, their friends, their dogs, their food, but none of them said police. And that is because not only is it legally factual, because police officers have no constitutional duty to protect you, Supreme Court case, but also because obviously we call officers when things get bad in our neighborhood, we call 911, things of that nature, but that doesn't necessarily make us feel safe, because oftentimes we're not in contact with police officers that much in our lives. It's really on catastrophic events, but we obviously need safety every day of our lives. So in some ways, it's kind of like a pie in the sky mentality to determine that police officers are keeping us safe 24/7, because there's just not enough officers to do that. So when we talk about safety in our communities and we look at policing, some of these things don't align perfectly. And we have to be mindful of that when we're talking about reimagining community safety in our everyday lives. So those are 2 things I always like to point out, and to say that we're not too far away from the solutions that we're looking for.
And so along those lines, what is your vision for public safety? What when you think of safety, and after having heard so many stories from members of the community, and also the stories from the police side as well, what's your vision even beyond?
Yeah, it was Rodney's world, and it was some ways perfect, unless you ask my wife, because my world isn't that great. It really looks like collaboration. Oftentimes you'll talk to executive level police chiefs, sheriffs, and they will tell you straightforward, we can't solve all of the world's problems. Although we like to think they can, because they have the most resources, and at least monetary resources in our governmental, our budgets and municipalities and things like that. So because they get the most money, and they have the most resources, they get tasked with a lot of the issues to solve. But to be honest, but police departments don't have the necessary skill sets to solve all those things. So for me, we really have to dial back in the way we utilize police resources and ensure that they're characterized where those issues take root. So for me, and you said it kind of in my background, I have degrees in public administration and public health and in law, and in a lot of the more refined things I do on a day-to-day is looking at where we characterize issues, right? Sometimes we think things are criminal justice issues or courtroom issues when they're really healthcare issues. Sometimes we think things are policing issues to solve when really they're better placed in a hospital, especially when we talk about trying to diminish crime in certain areas, or if we're talking about how do we reduce gun violence in certain areas. Oftentimes the knee-jerk reaction is, oh, we need to give police more resources, when really these are public health issues. When you map emergency room visits to determine where gun violence is related, you can really determine where gun violence is going to happen again next. Is that a really criminal justice issue? Are we talking more economic? Is that education? So for me, safety in a component looks like, okay, let's get the issue correct, and let's find the requisite solution that aligns with that issue, whether it's health, whether it's law, whether it's criminal justice. And from there, create a collaborative element to get to the end goal. And I think if we start with that plan in mind, for me, that is the vision, right? Because if you have the plan, you will more often than not get to the right solution. But far too often, it's business as usual. This is what we've always done, and we're going to keep doing it. We're a paramilitary organization. This is how it's going to operate. And I just think that closed level mind of thinking doesn't really put us in a place of success. So for me right now, I'm very practical because I feel like some of the issues that we're dealing with are so emergent that by trying to have just lofty dreams, it doesn't get anyone anywhere, at least not quickly. I look for just practical implications that we can implement day one that get us to ascertainable win so we can start shifting the needle. And for me, having that plan of saying, okay, this is where this issue belongs and this is how we can solve it right now is a really good starting place for a vision I can see for at least the greater Miami area.
Yeah, I mean, there are two things that really struck me in what you were saying. I mean, one, I think is like the emphasis on health, and I actually, in particular, I think about mental health and just the complete lack of mental health resources compared to the need, and also your use of the word paramilitary organization, because what I've heard, and I'd love to hear what you've heard also from people who've brought cases to the CIP, is the element of trauma in it, and what and how is the trauma that people have experienced either living in a neighborhood where there's been gun violence or where there has not been safety, and that they're experiencing kind of the sort of the structural violence of all the different systems that haven't been really welcoming or designed to really meet their needs. I'm just wondering how might actually the presence of police actually kick up these feelings of trauma. How does that exacerbate sometimes some of these the potential mental health issues that are in the neighborhood and what are in there that are in these communities? And I guess how does that fit into your vision?
Yeah.
What is the sort of solution that you see?
In some ways, your question suggests the answer, because it seems to be so commonsensical that we avoid talking about these kinds of things. And there's really two schools of thought of this, and I'll take it a step back and then we'll answer the initial question of does it affect people. There's a large groundswell of people that have been talking probably for the last decade on why police officers shouldn't operate in this paramilitary fashion. I've been in the military, I went to basic training, and I can tell you that they are only training you to do one thing, and that is to kill the enemy. It doesn't matter how many commercials you see with a guy running through a desert or a guy sitting at a computer saying, come join the military, they're training you to kill. And in some ways, our police department adopting some of those methodologies doesn't necessarily give us to what we're looking for in our communities, because we're looking for someone that can help us manage just critical issues. And that kind of hinges, or at least points to, this notion customer service policing, where it looks at, okay, instead of trying to diminish this with force, you're looking at de-escalating a situation based upon a customer service mentality. The logic here is that typically if someone calls a police officer, it's because they're probably having a bad day. And if they're having a bad day and they come to you, they want you to solve their issue. They don't want you to necessarily use force or anything like that, but they also want you to make them feel good once you leave that experience. Similar to if you were to call AT&T because your bill's too high. You're not expecting that customer service rep on the other side of the line to say, well, go away, we don't care about your business, and too bad, so sad. You're expecting them to fix the issue and then probably give you like a $10 gift card to Starbucks, right? So the issue here arises that, hey, if police officers operated with that mindset, then maybe, just maybe, we wouldn't have as many uses of force and just combative and officious language from our police officers. And that starts in the academies. If we stop training police officers with this paramilitary mindset, then essentially they wouldn't take those skills into the police force. So one benefits the other. It's kind of a reap and a sow relationship. To the other comparison, absolutely, if we have, and we say this oftentimes, a lot of our communities, especially the most marginalized ones, they are the most underserved yet overprotected, meaning they don't get a lot of services, but if they do get services, it's police services. And that's another conversation for another day, because we could also say that if that is the place where it's getting the most services of police, that means it's the most amount of money. If you put 10 police cars in an underserved community, that's millions of dollars that's going into that community. It's going into policing instead of education and homelessness and things of that nature. So all of these things kind of wrap into the trauma of what people see day to day. They see a lot of police cars on the street. They see, gang violence. They see there's so many different things that they're inundated with at very young ages. Obviously, that leaves some level of stress in one's life. And I think that's exacerbated by police presence from time to time. But police departments, in their defense, they have tried to become more beneficial in community policing efforts and things of that nature. But I think until we have a systematic, approach towards doing that level of targeted, of a targeted narrative, not only in resources but in messaging, I think it's really going to start falling on false ears. So a lot of that trauma that we're seeing now in our communities, and then it's being regurgitated on the news, it leaves a damaging effect. And I'll tell you personally, as I stated before, we get around 200 complaints in our office. Now with the advent of body-worn camera footage, that footage, in one case, we might have 5 or so camera footages, and I have to watch that, to do the investigation. So thousands of hours of body-worn cameras footage. A lot of it is stuff I don't want to see. And just from a personal aspect, I had to take a break from that level of trauma, just watching as a Black man in America and then seeing it on the news from my day-to-day job. So there is some, what I like to call, protect your own energy, kind of when you're in these spaces. And I know if I get it just from, a ground up view, I know people in the community are seeing it times 10. So that's something we have to remain mindful of in these conversations.
Absolutely, and I hope you're taking care of yourself. I mean, just a quick last question for you. I mean, you talked about a new program, community police mediations. What's your hope for that program? What would success look like?
Success for me looks like trust building. So these are going to be lower level cases of like discourtesy or certain improper procedures where there isn't a third party witness. Maybe he said, she said situation. An officer made me feel bad, although maybe I deserve the ticket. It's going to be cases of complaints like that. And for me, that's roughly a third of some of our cases. So we're looking to mediate somewhere in the realm of 50 to 75 cases a year. And in those conversations, it's really trust building. It's a police officer going into a room or a community member going to the room and saying, hey, this is what happened, for them to come to their own resolution of what occurred. And then for those people to go about their respective lives. And as we know, when people go out into the world on their own, that message travels. They say, hey, I met this officer and yeah, we had a spat, but you know what? That guy wasn't that bad. Everyone has a bad day. I see why he was upset and rude. He wasn't rude because he was mad at me because I was a woman or male or Black or white. He was upset maybe because his dog died that day and he took it out on me. And that's a human thing. And I forgave him, and now he coaches my son's baseball team or whatever it is. Or now he bought me a drink. Those are the outcomes that I'm looking for: building trust, building cohesiveness, people seeing officers as real humans with real human things. Because although we've got into this narrative of police lives matter, policing is a job. And I'll never, cease to say that, hey, if you lose your job as a police officer, it is not the end of the world. We shouldn't fight tooth and nail for some of these things. You're a human first, you're a member of the community as well. And I think if people from the community can get that from that level of interaction, we're really stepping towards something that looks more like safety, because you have that level of collaboration. And I often say it on the other end, police officers can't do their job without community interaction. Last time I checked, and I'm sure it's similar for you, Tim, that it's rare that people commit crimes in front of police officers. So because of that, they need community interaction to help solve their cases, to ensure some level of policing within the realm of their responsibilities. So it's a two-way street, and I think this program could help kind of plant those seeds that look like trust later.
Well, I have many more questions for you, but I'm sure that the audience
like exploding. I see.
Yeah. Well, right, and there's obviously other things that we didn't really talk about, like issues of race, immigrant communities. And
I think we really have an hour for this panel.
Yes, exactly. I know. So let's turn over to Tim, and then we'll hear what the audience has to say about this as well. So Tim. Cahoots actually was recently reported in The Atlantic. There was an incredible article about this program that you all have been running for more than a decade now, and so I'd love to hear more about the Cahoots' model. How did it come to be, and what are some of its successes?
Sure. So we'll start off just acknowledging that Cahoots is an acronym, and it stands for Crisis Assistance Helping Out on the Streets. We've been responding to dispatch calls for service as part of our city's public safety system since the 4th of July in 1989. Anytime you see one of our vans rolling around in the streets responding to calls for service, you're going to notice that it's a pair of folks that make up that response team. We always have one member of our team who is designated as a crisis intervention worker, and they're going to be accompanied by an EMT. That using that integrated health approach to our first response work, we're able to really, profoundly impact our public safety system. Our metro area here has about 230,000 folks between the two cities that we operate in, and we respond to over 24,000 calls for service a year. The types of situations that Cahoots teams are going to be going into range from crisis oriented around behavioral health needs. We respond to situations involving addiction or substance use, as well as homelessness and poverty. Some of the more specific areas that we do a lot of our work in are by responding to the majority of the welfare checks for folks who are considered a subject down. So that's anybody who's not up and moving in the community. We do a lot of counseling calls, a lot of referrals, and kind of resource navigation. And then we also do things like, death notifications and emergency messages. A lot of these areas where, there is a need to have somebody within the public safety system that can really help out in these situations. But, ultimately, if there's not a crime being committed, if there's not a weapon involved, nothing's on fire, no one's having a heart attack, then Cahoots is going to be looked to as the primary resource to respond to calls for service. Looking at just our calls within the city of Eugene last year, there were 105,000 requests made by the public of the dispatch system. Cahoots teams responded to 18,000 of those calls. We did 15,000 of them without any sort of other public safety systems to support us. 13,000 of those calls we went on would have required police or the fire department to respond instead of us. And we only needed to call for police cover 311 times. So that's less than once a day, with our teams operating round the clock. We're a 24/7 service. We have 60 service hours per day. So during the day when things are real busy, we've got 3 vans running around. At night, we only have a couple of vans. We've never had a staff member be seriously injured as a result of patient contact. And similarly, we have a really high safety record with our patients too. And a lot of that has to do with how we just interact with the environment before we even start to engage with a patient. There's a big emphasis on safety in our training process for our staff. And that starts by really understanding that the uniform itself that we wear when we are facilitating these interventions could be a trigger. You know, you might not have ever interacted with that, you know, that officer that's coming up to you on a traffic stop, but you have a physiological response, right? You know, you stress is activated when you hear those sirens, when you see those flashing lights. The uniform itself, you know, the creaks that the kind of the sounds that the bulletproof vest makes, or having that tool belt, you know, with all of those different weapons and other, you know, resources, those send a lot of messages, you know, right? And when we show up on a scene wearing a t-shirt, a hoodie, some jeans, and some work boots, we don't look like those traditional public safety resources that somebody may have experienced oppression or violence with in the past. You know, we send this cue that we're going to be a different kind of interaction. And we follow that visual message up by entering into these interventions from a place of mutual trust and using empathy to really facilitate least intervention necessary. And so we aren't, you know, pushing outcomes on our neighbors in the community that we're responding to. You know, it's really about recognizing that the individual is the expert in their lived experience, and it's that collective trauma. You know, the things that they've tried that haven't worked out, the things that do work well for them. Those are the things that we really need to be listening to in order to really facilitate an effective intervention. With our work, we are always trying to resolve situations on scene because we need to be mindful of displacement and connection to community as part of somebody's stability. But when we do need to connect somebody to other resources, we have the ability to do those transports ourselves. We can do those transfers of care. And so if we encounter somebody who's intoxicated and needs to get to sobering so they can, you know, sleep things off for a few hours, Cahoots teams are able to do those transmissions directly. When we encounter somebody who does need to go to the hospital, you know, we're able to do the same kind of direct admit that somebody might experience as if they had been brought in by an ambulance. And, you know, by being a part of that larger system, we're also able to catch not just the calls that are coming in for us, you know, like they would have on a crisis line. Because our point of access is within the public safety system, we're being dispatched just like every other resource within a public safety. That means anybody who's calling 911 or the non-emergency line, and for whom Cahoots is going to be the most appropriate response, they can actually get us to come out. You know, it's not something where you got to Google a number while you're in that escalated crisis, or try to remember, is it the Cahoots thing that I need because I'm in Eugene, or is it called something else? You know, you just call the police number that we've all, you know, so many of us have been conditioned to call anytime something seems wrong, something feels wrong for us. And so that's really what has allowed us to be so, you know, integrated in the larger system. I'll touch briefly on Whitebird Clinic and how we got here too. Whitebird Clinic is a federally qualified health center. So in addition to the Cahoots program, we operate outpatient behavioral health services. We have addiction treatment services that include medication as an option, case management, you know, medical and dental services as well. And the inspiration for our clinic goes back to the late 60s, when we were seeing a lot of the same issues that were going on in other West Coast communities, and a real profound need to have a different way to address the level of need, to address things like, you know, a young person who may be having an adverse psychedelic experience, being loaded up with Thorazine in the emergency room and then just treated, you know, discharged in worse shape than they went in. You know, recognizing that law enforcement was being obligated to respond to all of these situations that weren't criminal, you know, that were really about a lack of resources. And, you know, from really humble beginnings as a free clinic, you know, with a crisis line that folks could call, we started to offer community-based crisis response services while we continue to really expand our services. And I think the thing that really allowed us to enter into the partnerships that we needed to make the Cahoots program successful were predicated on the fact that our agency got to spend a lot of time really building the trust of the community. And we became a place that law enforcement really saw as a viable diversion resource. You know, officers were bringing folks into the crisis center and trying to refer them to other Whitebird Clinic resources. And it was that opportunity to, you know, find those partnerships, right, and to really, you know, accomplish those really profound diversions from other systems that showed our community that we could be trusted to be a part of that dispatch, that we could have a role to play in the larger public safety system. And there was a community policing grant that became available. The two things that came out of that policing grant were the Cahoots program and a nonprofit that facilitates our sobering center. And because our two programs really kind of were born at that same time, you know, that's where we have seen our biggest impact in actually just keeping folks out of the emergency room in general, is that we can facilitate a lot of that work around harm reduction, you know, around addressing addiction and, you know, self-care deficits by not needing to engage law enforcement for these, you know, these issues that are non-criminal.
I just have a quick question, a quick follow-up on that. I mean, because now you see a lot of municipalities calling for like an alternative to 911, like there's in 311 or some other number that of that ilk. What is your recommendation on that front? Because it sounds like you're still using you all go through the 911 system, and so I wonder. I mean, how long did it take to move from sort of what we know 911 to be in other municipalities to what it is now for Cahoots, and kind of like what is the sort of adaptation period?
Yeah, it certainly took a couple of years for call takers and dispatchers to really understand how to best most efficiently utilize this resource. We lean on things like the scope of service that's in our service agreement to really identify the exact call types, what the dispatch codes are, and that framework really helps dispatch contextualize how the Cahoots response can be folded in. We do need to recognize that when we started this service and chose to use dispatch as our point of contact, that was all really built on the privilege of being comfortable calling public safety, and over the last year, we've received the feedback from our community that there is a big need out there for there to be another way to get a hold of us. And I think that we're really fortunate with leadership that we have in the city and with our local law enforcement agencies to really, there's a firm understanding of why the community is asking for that. And we've gotten a commitment to really evaluate how we can still maintain the fidelity of our service, maintain that broad reach, but also create opportunities for folks who aren't comfortable utilizing us because we are, on some level directly connected to law enforcement to feel like they can actually reach out to us.
That's so interesting. There are already like a bunch of questions about how to bring Cahoots to South Florida. But before we get there, there's another question that I have, which is around, safety to a certain extent also is dependent on the extent to which a community is cohesive, right? A community cares for each other, that there is like some level of like collective responsibility for each other, right, in this community. And I'm just wondering, over the years that Cahoots has been operative in Eugene, have you seen a shift or a change towards people really, sort of thinking about perhaps their own responsibility in helping to assure the safety of others? Like, has this program been a part of that, that type of, raising of consciousness?
I would argue that is the case, but it's not by just going out there and responding to calls for service. I think by making that commitment to our community to be there for them so that they don't have to have that interaction with an officer, so that they aren't, waking up a whole station of paramedics at 4 a.m. We have to really be committed to outreach and advocacy as well. Because if folks don't think that we have their best interest in mind, then they're not going to call us in the first place. And, before Cahoots was Cahoots, when it was really just kind of Whitebird Clinic, and through, today, we have a really firm commitment to community education. And that means spending the time talking with folks about how to call the cops, how to call and how to interact with public safety in general. We take the de-escalation training that we provide to our staff and facilitate those in community education settings. If you're a volunteer for one of the winter shelters here, you're going to go through the Cahoots de-escalation. If you work for another service provider, chances are that at some point we're going to do a learning exchange where Cahoots team members are going to come in and talk with you about that de-escalation that we do. And through all of those outreach opportunities, it's not just a one-way interaction where we talk at you and you listen and you go away. Right? We make sure that there's opportunity for us to hear the voices of our community. Anytime that we go out on a response, that's an opportunity for us to really demonstrate to other folks how we could be of service to them when they're in crisis too. And so I think that, by really kind of maintaining that recognition of our obligation as stewards in the community, as well as first responders, that we've been able to, shift a lot of the narratives, a lot of the conversations. More recently, we are seeing a lot of the same sweeps that are happening of encampments as a lot of other bigger cities. And where years ago, when I first moved to Eugene and we'd hear about a camp sweep, there was this just assumption that, they're just gonna go find their way to a service and they'll be okay. That was kind of this flippant, lack of regard for for their experience. But, over the last 10, 15 years, we have really seen that when these camps are being swept, that the community is asking, why did that encampment have to form in the first place? That there's a call to action to say, if you're going to sweep this camp and tell these folks they can't be here, then this city needs to find a way to give them somewhere else to be, And so I really do think that that's because of our work to really educate and inform our community.
That's amazing. Well, I guess maybe sort of leading into the question of how we can get a program like Cahoots in South Florida. I mean, what you've already been a part of, helping to seed this model in other places. And so what are some of the things that a municipality needs to implement or take into consideration in order to put into place a model like Cahoots? Yeah,
it sounds like it's really easy to say, but services, it's really about making sure that there are adequate resources, in a community. The reason that we are as successful as we are here in Eugene and Springfield with our Cahoots program is because of our partnerships with other providers in our community. It's because we can take somebody somewhere to get a shower and do some laundry, take somewhere to get a full belly, get somebody a place where they can camp for the night and not get hassled. And so as communities are really looking to implement mobile crisis programs like the Cahoots model, there needs to be dialogue around what are our low barrier shelter resources. Where can folks go to meet their most basic human needs? What do we have for outpatient, mental health services? Do we have a crisis center? What do we have in the form of addiction services? Is there treatment on an outpatient basis that, uses the harm reduction model? I think we really need to recognize that no one service is going to be, one size fits all. And so every service that comes into a community really should be something that's responsive to the needs of the local community and is accessible. That's really what it is. Oftentimes you'll see a service that says you can come in these doors, but you need to be able to abide by a really high bar of behavior. You can't yell. You need to conduct yourself in a way that we have reached consensus on as being the appropriate way to conduct yourself. And that completely disregards somebody's experience. It completely ignores what it might have taken for somebody just to get through the front doors of your facility that day. And so, it's really ultimately about making sure that the community has the resources and that those resources are informed by those who are going to be accessing them.
And one last question for me before we go back to the audience is, there's been a lot of, I think, backlash in various places because of defund the police and just polarization generally on this issue. And I'm wondering whether that has at all impacted how the community has been receiving Cahoots, either in Eugene or in perhaps some of these other places where you have been kind of talking about, adapting the model.
One of the things that's come out of the last, 9 or 10 months is that a lot more folks are gaining, a literacy in their city's budgets, that there's a better understanding of the larger public safety system. And so as we have found these opportunities to engage with other communities, generally my experience has been that folks are more and more informed, right? They know the names of elected officials on city council that they might not have known before. They understand how money is being spent. They understand the process. And it's easy to kind of just lump everything in under the umbrella of defund, but what we represent is really a reallocation, and I think a realignment of resources. And local to our own community, over the last few months, what we have seen is that there is resounding support. Sometimes it's misguided. There was a petition that garnered over 15,000 signatures, which is about 10% of our population here, that was in favor of reallocating 30% of the Eugene Police Department budget, or about $20 million, to Cahoots. And we weren't involved in that petition. We didn't sign it. We didn't endorse it. But that really showed us that our community really valued the Cahoots program enough to say that, hey, we should make a huge slash to the budget and put it into Cahoots. My personal response was that $20 million would make a really great shelter. you know, with some 24-hour bathrooms and, you know, a kitchen for folks to feed themselves. That sounds like a really, you know, much better use of that money. But ultimately, locally, you know, I think that we're seeing our community really just understand the gravity of the experience of so many. You know, Eugene has the highest incidence of homelessness per capita in the United States. We are a fraction of the size of Oakland, and we have half the homeless population that they do. You know, and so there's just so much need, and I really am grateful for what this movement over the summer has really done to really shift folks' perspectives and start to ask some really important, really critical questions, and you know, even in some cases, pursue leadership. And so if we can be a part of that, if we can be a part of, you know, answering some of those questions out there, you know, so much the better.
That's awesome. And yeah, I really appreciate you kind of raising up the more systemic issues, kind of the root causes of much of what we're talking about. Okay, so let's turn it over to the audience. It's your turn, audience. So get your questions going here. We already have a few that have come in. The first one is for Rodney. The question is, why do police think 6 months is enough for appropriate training? Where is the data that says that's enough?
Well, I don't know if it's a matter of if police think it's appropriate. I think it's just a matter of resources. Police departments usually or typically think they need more officers because that breeds more strength for whatever reason. In order to have more quantity of officers, it takes a faster pipeline in order to do that. Now, I think another question is the requirements that are put in place for police officers to hold a gun and badge. In some jurisdictions, you can be as young as 18 and be a police officer. Not saying that age should matter that much, but some of those requirements could be more stringent. So I think looking at that, if we keep policing as it is currently, I think looking at that are some of the things that we should also consider. But you know, whether it's 6 months, 1 month, 18 or not, I think some of those questions are more so the remnants of the root issue. The real issue is, should we police the way we're doing? And if you change it up to more of a customer service-based policing method, maybe not using lethal force in certain interactions, using programs like Cahoots, you probably don't even need 1 week of training to know how to be a normal human being and treat people with respect. So those are the things we want to answer and get to. The other things, I feel, could be just more of a distraction.
The next question is for Tim. Are aged out foster care youth eligible to receive the services or homeless youth for the services you provide?
Just like an ambulance isn't going to check what your status is before they, you know, secure your broken leg or whatever it is, we don't have any restrictions on who we serve. If you're breathing and you're in our service district, then you are eligible for Cahoots services.
That's good to know. Keep the questions coming, audience. In the meantime, I'm going to ask another question. You know, as we know, last year was it shook free lots of conversations, not only after the killing of George Floyd, but also with Breonna Taylor, Ahmaud Arbery, and you know, a too long list of people who'd been killed. And so we were wondering, what were the responses of your organizations after, you know, not only after the killings, but also after, you know, the mass movements that we saw across the country?
You know, with Whitebird Clinic, there were 2 things that happened. One was, you know, I think a more external and explicit commitment to racial justice, you know, and some statements, and I think really fully outlining where we stood on the matter. But then internally, it forced us to really spend some time evaluating ourselves and our practices. You know, Eugene is primarily a white community, and our organization is predominantly white as well. And you know, we sometimes can rest on our laurels and say, hey, you know, we're doing a really great job serving the homeless and you know, the uninsured, and we're, you know, we're meeting our mission. But you know, ultimately, if you're not taking the time to really look at how, white supremacy and white fragility inform organizational practices, then you're never going to be able to adequately respond to the issues like, we really saw come to the forefront over this last year. And so our organization has really taken the time to really thoroughly evaluate how our services are provided. Are they equitable? Are they accessible? And so, the concept of a different point of access for dispatch is just one of many different things that have, come out of really responding to the widespread inequity and violence that so many communities of color are experiencing.
Rodney? And you can feel free to also fold in your own, sort of view on racial justice and kind of the sort of systemic changes that you believe are necessary in order to kind of deal with the root causes of what we saw kind of spurring the protests of last summer.
Yeah, well, just as an aside, I was really just proud of the people of South Florida for really pushing their government and elected leaders for establishing civilian oversight of law enforcement for the Miami-Dade Police Department, which is, as we know, the largest police force in the South. Really just a call to action on that. Over thousands of people signed a petition and, really forced the hand of elected leaders to do something that the mayor had vetoed more than once in years past. We were able to come together and say, no, this is something that we feel is necessary. Although George Floyd didn't die in our backyard, it could easily happen here or anywhere else. So I really felt proud in that moment to say, hey, when the rubber meets the road, we step up and we do things that no one expects. So I think it's that kind of bravery, that kind of collective action by not only our community members, but elected leaders that really are going to push us towards an area that looks more equitable in race relations.
We just got a question in here for you, Tim. What kind of support does Cahoots currently need to provide an even better service? And they say that you already mentioned a shelter, but what other services would be good?
Yeah, I mean, really everything. We do have some shelters here in town. We have both a congregate shelter and then we have a system of sanctioned camps that are really self-governed, but there are still hundreds of people, if not thousands, every night that are sleeping outside or, trying to bed down on the outskirts of town. And so, whether it's housing or mental health, addiction treatment, there's just not enough resource out there to really meet the need. Talking about that example of that petition to really, profoundly increase the Cahoots budget, if we had done that, if we had increased our budget by tenfold and had 20 to 30 vans out in the streets rolling around, all we'd be doing is queuing people up in the emergency room. All we would be doing is really just kind of pushing people around without really improving anything about their situation or their experience. And so it's every service across the board, because there's never going to be a one-size-fits-all crisis center. We're never going to find one permanent supportive housing option that's going to work for every single person. And so that's, again, why we need to listen to our community, listen to the folks who are asking for these services, those who are in need, to really help us and inform how we implement new services and where those priority areas are going to be.
Absolutely. Circling back to you, Rodney, on that previous question, I mean, kind of related to just the events of last summer, I was wondering, one, whether, you saw an uptick in complaints or just kind of questions about the CIP. And then relatedly, I mean, because this conversation was so much, at the forefront, and there were, not only were you reviewing videos from, these complaints, but you were also seeing, whatever was being put out into the sort of public domain. I mean, how have you yourself, kept healthy and kind of kept yourself grounded as, just kind of the gravity of these issues or the magnitude of these issues can sometimes be overwhelming?
No, yeah, to your point, they're definitely overwhelming. But I just, it's my job. So I lean into it. And I think having a CIP in our space is better than not having it at all. And, I try to make myself as available as possible, whether it's on social media or in person or over the phone. Even in our COVID space, I just feel like we're an essential service in that way, because if we can, stop bad policing before it happens, we've done our part. I think a lot of this, at least over the last year or so, we haven't received like an uptake of complaints. At least we haven't seen in our data just yet. People haven't got more interest in our work and knowing more about what we do, just as a natural byproduct of people being interested in policing efforts. We did have that one case in the city of Miami last year where a black doctor was stopped in his own community and seemed as though he was being racially profiled just because he was in an affluent community, very esque of Cambridge Police Department back in the day. But outside of some of those nuanced cases, we're pretty on average for the amount of complaints that we're receiving, which can be good or bad because most people are inside, and the fact that we have the same amount of police complaints yet less interaction it could be somewhat concerning. But at the same time, we don't quantify our work and the amount of complaints that we get because, to be quite honest, people file complaints for myriads of reasons, and they don't file complaints for various reasons. It doesn't mean police misconduct is going up, doesn't mean it's going down. It just means that this is what we have. So we utilize what the community gives us, and we try to do good work from that. But really, we try to be preventative. We try to predict these things via a pattern of practice before it gets out of hand. But for me, I just try to compartmentalize these things. This is my job. I feel as though, like I said, having a CIP in our world, in our space, is better than not having it all. And we need good people to step up to do this kind of work. We have a small team, a small office, just 4 or 5 of us. I like to think we're one of the better civilian oversight entities in the nation because we're staffed well and have a good budget. But at the end of the day, we have a job to do, and we can't turn a blind eye to that just because it gets hard or stressful. We got to do the good work.
Well, we appreciate you, Rodney. I guess that this question can be answered by both of you in your own way. It's from the audience. What is the best way to, let's say, create compromise between the police, social workers, and other mental health workers? And I think maybe, Rodney, you can answer this from the perspective of, what kind of, what prospects, does Miami have to achieve a program like Cahoots or a way forward that does end in more resources for social workers and other mental health workers? And then I guess, Tim, perhaps the question for you is how did you all arrive at a place where you could get the police on board with some of these other services that you were trying to offer the Eugene community?
Yeah. Well, I would say to the members that are watching this and anyone else that, that's not outside the scope of reality. I think there's a large appetite for programs similar to Cahoots. I dropped in the chat box St. Petersburg, Florida, which is in Pinellas County, just a little bit north. I know no one from Miami travels further than North Miami, but there is the rest of the state up there that are doing some good work around policing with similar programs that look like Cahoots. I even think it's more of a possibility because at least the mayor of Miami-Dade County is a former social worker herself. So I think there is a large appetite for programs like Cahoots to work with police departments in order to ensure this level of collaboration that we're all yearning for. I don't think that you would have an issue with most executive police chiefs or sheriffs. The only issue you may run into is police unions. And when we talk about collaborations, usually they're the ones that thwart any good efforts from elected leaders and executive level police officers. From my experience, more often than not, I can get the police chief on board, I can get the sheriffs on board, and the assistant chiefs on board. Usually the unions kind of throw a wrench in the system. So when we're looking at that, at least from a top-down approach, I often tell people you have to manage your expectations of what outcome you want. If you want a police officer to be charged for a police-involved shooting, you probably should be mad at the state attorney or your district attorney, not at your police chief. If you're upset that police officers are getting paid while being suspended, that's a collective bargaining issue that you should be upset with your local elected leaders and maybe some of your union members. And if you're upset about departmental orders and things like that, that's more or less a chief issue. So some of these things are collaborative expectations that we have to manage, making sure we're talking to the right people at the right times in the right spaces. But some of these other things are really just kind of pushing the needle, because I do think the appetite is there and people want to see change on both sides of the aisle. But it's just figuring out how we do it the best way, the most practical way, and using our money in ways that give us the best bang for our buck.
something that I hear a lot when I talk to other communities is that, officers didn't sign up to work for a police department because they were really passionate about, being a good mental health worker, right? They're not signing up to be a law enforcement officer because they're passionate about social work. It's because they're passionate about the policing. And we have this tendency to just obligate police to handle everything that we don't have another resource for. Is it dogs? All right, like police need to handle, animal welfare now. Mental health calls. Okay, let's send officers out to go de-escalate that situation. And so I think we really have this opportunity to just kind of stop and look at what it is that's lacking from that system, and talk to these municipalities, talk to leadership, about how we can bring in a model like Cahoots to really just better utilize limited resources. This isn't popular with the defund crowd, but if you don't reduce a police force and you bring in a Cahoots style program, inherently you're creating a force multiplier, right? You're not obligating those officers to handle those mental health calls, to go out and tell those folks that they can't camp where they are right now. You're sending in another resource that can be a lot more supportive, and that's inherently going to make your officers more available for crime prevention or whatever it is that they signed up to do. And so when we take a moment to look at this outside of the politics and really just kind of look at efficient use of resources, trying to manage limited municipal dollars, it makes sense. It's also just the most compassionate thing that we can do, right? We don't send police to go stop your bleeding. We don't send police to go put the fires out. So why do we send police in when you need de-escalation?
Well, we just have a couple of minutes left, and I don't see any other questions from the audience. So I guess maybe we can, do a little round robin, just like a 1-minute summary on just the takeaways that you want to leave our Miami crowd with.
Well, I think for me, it's really that whether or not Miami's ready for bringing in a Cahoots program, this is a tremendous opportunity that we have right now to really ask, what does Miami need? What are the resources that aren't there? And how could those resources be brought in? How could they be implemented in a way that's accessible to everybody? And then from there, start to ask, how does the mobile crisis response fit into that system?
I absolutely agree with Tim. I mean, I try to operate, at least when I go into police spaces, usually by myself with a legal pad with all the brass, that, closed mouths don't get fed. And oftentimes when you're sitting at these tables, there's only a couple people that really speak on the behalf of the community in very innovative and practical ways. So if you know about programs like Cahoots, or you just heard it one time on a panel or something, ask about it. Because sometimes you'll be surprised that they will actually work in collaboration with you. One thing that we didn't speak about on this, so I don't want it to go unspoken about, is corrections in prisons. Obviously, there's correctional oversight for some jurisdictions that do similar work that we do, but on the corrections end. And I do want to have at least a moment of focus on that, because there are still prison systems that ostracize people, that in some ways ensure that people stay in prisons and don't get released. And there's a lot of correctional officer misconduct as well. So although, obviously if we fix the policing issue, then people don't end up in prison sometimes, but we also have to, complete the circle and say, hey, we have to make sure that we have people beating the drum on correctional oversight and correctional officer misconduct as we do in policing. It takes both, and we need both now more than ever.
Thank you so much for bringing that up. I mean, the system is broken in so many places, and we need to fix it holistically. I'll take a moderator's privilege to throw in my 2 cents here. I think a lot of what I hear from Rodney and Tim is, the importance of people speaking up and speaking out. And I think, we live in a democracy, like we have a government that is supposed to be responsive to our needs, our demands. We pay taxes, that these budgets should be working for us. And so if we're upset about what's going on, let's not get delusioned, but actually let's get active. As Rodney was mentioning, as Tim was mentioning, we have to use the channels that we have to speak out and to really be vocal and let our electeds and others know just what are the things that we believe are going to be good for our communities and useful, and will keep us safe and healthy. So thank you to you both for this great panel. Thank you to Catalyst again for having us.
Thanks to our great moderator.
Yes, absolutely. Thank you, Meena.
Amazing work.
Yeah.
Thank you. And thank you to the audience for your great questions. Enjoy the rest of the summit and enjoy your weekends.